today. I know it's been a while, like maybe about a year, maybe. Well, anyways, this video, it's going to be about road to boobs. I know, let's back up a little bit.
Woo! Woo!
Yeah, so of course, yeah. It's a present to him. Anyways, so just a little life update. I am a functional health coach. I've been doing that for the past couple years, so I've been so busy and not on YouTube. You can find me on Facebook or Instagram, ashleyjshieldsfit. If you have, I deal with a lot of people that have health issues, you know, weight loss resistance, autoimmune diseases, you name it. I do it. I help people heal. Anyways, you're probably like, why are you getting breast implants? You know,
Why
because
not? That's the question you should be asking.
So this is the thing here. There's a lot of talk about breast implant illness. Okay, so it really kind of just depends on your health. I feel if you're actually going to, you know, essentially have that problem. So I've done a lot of work with my gut health, and there is things I can actually do to help prevent that even after surgery. You can go through a certain protocol to reduce inflammation and healing to your body. You can have a less likely chance of getting BII. I feel very confident that I will be absolutely fine with getting them. So, and obviously this is a personal decision of mine. I've wanted a pair of boobs for, well, actually since I was in my 20s, and since I have been with my husband. Don't you agree? I've mentioned boobs to you for a long time.
Since I met her, she's wanted boobs.
Yep.
And so have I. I've wanted boobs. A whole bunch of them in my face.
So it's not just like a out of the whim, like, oh, I just want them just because. No, I just been wanting them forever. And it's more of a self confidence, just feeling proportioned. Because if you look at me, I am smaller up top, bigger on the bottom, and I just feel like when I got to try the boobs on, because they give you a whole bunch of boobs to try on in the consultation, which I had about 1 week ago. When I put them on, I just felt proportion. Like I was like, wow, this is awesome. I felt really great. So that's why I want to get them. And I feel at this point in my life, I worked very hard and I deserve them per se. But anyways, we did the consultation and I dragged my husband along because, well, he's gonna take care of me, and you know, he has to like my boobs too.
He wants to vote on them too.
So, I got to try on different sizes from 300 cc's to 450 cc's because I knew I didn't want to go huge. I wanted to keep it more natural. So they give you like a sports bra and a shirt to wear in the room, and you get to try on the boobs, you know, underneath your, you know, sports bra to essentially get a look. And I actually have photos, and my husband, he's going to be my editor. He'll pop them up right here. You can see the ones that I'm essentially going with. He just rolled his eyes because he knows he's my editor. So that's what I'm kind of going with right now. It's going to obviously look different once I have surgery. You know, they're going to be more lifted. It's going to be more natural looking. So anyways, you know, he's going to be the one taking care of me, you know, the couple days after surgery and whatnot. But we still have a couple more appointments to go. I think maybe one. I think I have one more appointment before surgery. So I'm pretty sure I do. Pre-op appointment.
You have two after.
I have a pre-op appointment. Oh. So I'm hoping then maybe you can meet the doctor. I can, you know, I'm working with Dr. Labrasca. So he's in the Brookville, Du Bois area in Pennsylvania. He has a TikTok and Instagram. I just really like him. I like his personality. He makes you feel really, really comfortable. So I'll take you to that appointment. Cost-wise, because everybody's going to be curious, like what cost will be. Really depends if you need a lift or not. You know, it depends on like the size. So they can anywhere from 7 to 9K is the going cost right now for actual implants.
It's kind of like if you're going to buy a new car, and you're speccing it out, whether you get the base model or you go for the jumbo model. She went for the mid-grade.
I guess that's the best way to explain that right there. today we are here for my pre-op appointment for boobies. So we're in the Hollidaysburg office for Dr. Labrasca, and hopefully I'll be able to record a little bit of my appointment. I'm assuming he'll be okay with it because he's, you know, on TikTok and Instagram and does all that cool stuff. So I'm excited to see what's going on.
I'm also here for boobies. Not for me. I mean, they are for me. Skip? You gonna skip in, or are you just gonna wave your hand around? That's eye clinic. Don't you want to go to the surgery center?
Oh yeah.
You gonna get your eyes done too while you're here? Okay.
So I'm here today with the doctor that is doing my surgery. So here is Dr. Labrasca.
Hi, how are you? I'm gonna do 350s. We talked about under the muscle, and we talked about a little bit of a lift. I don't exactly remember the lift, but I looked it up. It was like one side's a little higher than the other one, and we do that just to match them up. What other questions do you have?
Well, just some random questions.
Yeah.
So I saw you can't wear fingernail polish.
That's just so that they can put the.
Yes, I was gonna ask this. So my question is, as long as I have these two polish off, is that would that be okay?
I don't know.
Oh, okay.
So everybody, each of the anesthesia people are a little bit different.
Okay.
Some of them are going to be like, absolutely not. You have to. That has to be completely clean. And others are like, I don't care as long as I see light. And I've even had others who are like, as long as their toes are good, we can put a thing on their toes.
Oh, I have my finger. My one question is, can I still take magnesium?
Yes.
All right, good.
Yep. That's fine.
Okay. I said I can get my COVID test done on this Saturday.
That's fine.
So.
Sunday.
What?
70. It has to be 72 hours. I think Saturday is 4 days.
Okay. She said sometimes they can do 96 hours. The girl that, so I don't. As a girl from the hospital, I guess that.
Okay. If they say it's okay, that's fine.
Yeah.
If they decide it's not okay on the day of, you may have to take another one the day of.
Oh, okay.
So day of surgery, you're gonna come in. They're gonna give you a gown, IV. You're gonna wipe yourself down with some stuff that smells bad and is sticky and kind of gross. Then you're gonna go down to. You're gonna go down a floor. You're gonna meet me. I'm gonna draw on you. I'm gonna answer any additional questions you have.
Okay.
I'm gonna ask you, hey, what are we doing today? You're gonna say, what are you doing, dumbass? You already know this. And then you're gonna go to surgery. You're gonna go to sleep. You're gonna wake up. You're gonna do fine. You're gonna be groggy. He's gonna mess with you.
He's
all that
forgetting
type
to
of
give me
stuff.
a
video.
Yeah, you always do that stuff to me all the time. Get me
You're gonna have dressing that's gonna cover kind of essentially this whole area.
Okay.
And you're gonna leave that on until I see you, or till you see Michelle about a week after surgery.
Yeah.
You're gonna do fine.
You put people on antibiotics afterwards?
I do.
Okay.
Yep. I do. Implants. Okay.
Yeah.
Implants, incision. So you have.
I try to avoid antibiotics because of gut health and.
I understand.
If I understand.
This is. Just take what I give you, though. Okay.
Okay.
All right. Just take what I give you.
Okay.
You can do all your gut health stuff, but okay, we're gonna do a lift.
Yeah.
With the lift, there are little bacteria that live inside your ducts. Okay. That we can't clean with surgery. Okay.
Yeah.
So what I do is I put the implant in. I close that up completely, and then I do the lift. There are some people that they'll put the implant in through the lift scar to make it less scar, but there's more risk of complications that way. So we do a separate incision because I don't want any bacteria getting on the implant, getting into anything. That said, there's still a chance of those bacteria that are in there getting out, causing issues. So I love antibiotics, especially with implants, okay? So you get antibiotic pills after surgery, you get an antibiotic IV before surgery, you get antibiotics wash inside the pocket, you get antibiotic wash all over the implant, you get antibiotic rinse all over the incisions. Like there's a reason my infection rate for implants is 0. Okay.
Gotcha.
All right.
All right. Just wondering.
So gut health and all that stuff, super, super important. Just give me a couple days.
Okay.
All right.
Yeah. Gotcha.
Other questions, concerns, etc.
No, I think you pretty much answered all of them. So.
Okay. Sounds good. So what we'll do is then we'll give you a gown, we'll take pictures, we'll answer any additional questions you have, I'll take another look, and then we'll have you sign consents and get out of here. Okay?
Sounds good.
Let's do that while we're here.
So I'm very excited, nurse, at the same time. I was wearing a mask because I was trying to be respectful because of me having an upper respiratory infection. Otherwise, I would not wear a mask. So I was just, like I said, just trying to be nice. So, but yeah, I'm really excited. Surgery's in 6 days, so we'll see. I'm pretty sure my husband will.
6 days.
I know. I'm pretty sure he'll get videos of me looking groggy, groggy, and all that good stuff.
Do we do it before and after?
Yes, there's nothing there. There's sad boobies. There's sad boobies.
Oh, babes empower babes. Boobs empower babes. You ready for this?
I don't know. Hasn't totally hit yet.
Has it hit you yet?
I don't think.
Why don't? Do you want to talk to the camera, to the people?
No,
Any final last words?
no, I'm just gonna want to get this over with and done with.
Okay.
Don't like
Yeah.
anesthesia,
All right.
you know?
Boobs or bust. I guess or boobs and bust.
We'll just have to get the after effects.
Okay.
How do you feel about getting a catheter?
I did not know.
Really nervous, aren't you now?
Yeah, well, the
You're
good
not-
thing is they said they'll put it in when I fall asleep and before I wake up. So I guess that's a good thing.
Yeah, you're not even gonna know it.
Whereas in my hoo-ha, it's gonna be
It's gonna be like me. You're not even gonna know what's in there.
that's scary.
One eternity later.
You look wonderful. How do you feel?
Sore.
How did it go down?
They hooked me up with all this shit. One nurse was here and yours was there, and your arms were just out there when they were hooking everything up. And they gave you some stuff to calm down.
And you calmed down and you woke up.
It's about what happened
And now you have ice packs on your.
on my boobs.
Mm-hmm.
Yeah,
The doctor told me everything went perfect.
that's great because he had to. I didn't know this, but he had to fix my areolas too.
Yes.
One was bigger than the other.
Yeah, he told me.
My boobs were a hot mess for not having any.
So she was feeling nauseated. Then they brought this up.
Oh, that's just disgusting.
Yeah, so that made her more nauseated. Cue the I'm coming home music. Huh? How you
Yeah.
feel?
Sore.
She's sore, but she's on morphine, so she's not nauseous.
And they gave me some oxycodone.
Oh, well, you feel good then. You got any extra? She loved the gown so much that she brought it home.
Yeah.
Do you want to show everybody your wonderful bra?
Well, it was buckled in.
There it is.
I have ice packs shoved down in there.
Yeah, so they're even bigger.
Yeah.
So what all medicines do they give you to take with all this?
Pretty much Dugalax in case you get constipated from all the pain medicine. Then oxycodone for the pain, and then obviously antibiotics.
Mm-hmm. What are you taking? Whatever you can get out of my lunchbox, right? First day post-op. The cats obviously are being protective of their mother. You can't stop her. She's working.
little bit, not much.
Yes, you are. You're working.
Just a little bit. I'm not. It's not.
I woke up and she wasn't beside me, and I was like, "What the hell?" And she was out working at her desk,
Whatever.
resting.
I am resting.
Rest.
I am in the bed resting with my cats.
End of day one's ending just like it started. 2 cats, wife in the bed.
Yeah, it's very sore still.
You watching over your mummy?
And he's thinking about getting in that.
No.
Oh, look. Come to see you. Update on my post-surgery. So I would have to say definitely the first 3 days after surgery is by far the worst. Definitely did not expect having my husband bath me.
I'm not complaining.
Yes, because it hurt so bad, and why I say that, it hurt so bad just moving my arms. Like, you won't believe how much you actually use your chest for. Like, I was still getting over a cold, and I had to blow my nose the day after surgery. That was excruciating painful. So it's crazy what you use it for. He had to help me get dressed, put my shoes on. He had to do a lot of that. But the pain did get better a little bit each day. And if you can, this is a tip, with the pain medicine, if you can slowly wean yourself off of it, that will be great because it causes constipation. Horrible. So what are some things you can do just so, you know, I can help you out? Make sure you're taking at least 1,000 milligrams of magnesium glycinate before bed, and taking at least 1 ounce aloe vera juice at least 3 to 4 times a day. That will help a lot. And make sure you get a lot of foods with fiber. That will help start getting your bowels moving. I would probably say by the 4th day, I was definitely probably only doing like a half a pain pill a day. Like, I was just tolerating the pain kind of deal. It is now essentially a week after surgery. I can now like actually dress myself, like open doors, do those type of things. He still helps me get a bath still, because there's certain areas that I have trouble getting, you know, like with my arms, but a lot better. So yeah, we are on our way today to the Dubois office with Dr. Labrasca for a 1-week follow-up, and I believe I have the nurse practitioner because I think he's on vacation. So if we can record in that appointment, we will, but obviously she'll be looking at my boobs and make sure they're healing well. Obviously, I'm not going to be showing that on camera because that wouldn't be very PG. So, but we'll camcorder what we can. But yeah, otherwise, I'm getting there, and I can't wait till they're fully healed. Here we are.
Okay.
I'm covered.
That's fine.
I'm covered.
For 2 to 3 weeks after surgery, you really can screw it up. So don't. Okay? That includes heavy lifting, strenuous activity, going. One of the most common things is sometimes women, they'll go a week or 10 days or whatever without doing any laundry, and then they'll go and they'll just pick up the laundry basket all at once, and it'll, you know, they'll feel a tear here, and you'll open up a blood vessel that I had previously cauterized. So for up to about 2 weeks or so, you could really pop one of those back open again, and then one side fills up with blood. You have to call me. We have to go back to surgery. We have to fix it. So just don't do it.
When can I like start walking on the treadmill?
You could walk in another week.
In another week?
Yeah, right now, what I say, like first week you can walk around inside the house, second week outside the house, third week around the block. Okay? And that works for the treadmill too. I don't want you to do any arm stuff until you're about a month out of surgery, okay?
I figured out before.
Yeah, so, you know, walk on a treadmill like this, or whatever, or an elliptical like this, okay? And after about a month or so, you can start to do some of the arm movements or whatever.
When can I start doing lifting legs, would you say that would be? Like what?
Somewhere right around the same time frame, but we're going to start light. You know, we're going to do stationary bike and stuff like that.
I guess I'll know more once I come from my 6th week or whatever.
Yeah, but you'll be able to start doing some stuff before that, some
Oh.
lighter stuff.
Okay.
After I see you at your 6th week, no restrictions after that.
Oh,
Okay,
okay.
so we start super slow and we ramp slow, and then we gradually start to ramp up right around the 4-week range, and then at 6 weeks it's no restrictions. You're still not 100%, but no restrictions at that
Okay, I
point.
see what you're saying. Okay.
You
Thank
look
you.
awesome.
Thank you.
Everything looks so nice.
It's really weird now that I have boobs.
I love that plan. You
Yeah,
look great.
thank
You look
you.
great. What did you think when you put that bra on just now?
It was just weird. Like I'm like, a lot more comfortable
You-
than that surgical one. But
Yep. You'll get used to it fast. You'll be like, hey, look at me.
yeah.
Yeah, I like that. Clothes will fit differently.
Yeah.
It'll be a new experience, and I'm excited for you.
Yeah, I'm excited. Yeah, I can't wait till I'm like fully healed, and
Yep.
I can't wait till I get back to exercising.
I understand. I understand.
Because not being able to do that. Oh God.
So if she's mean to you, it's my fault. I'm sorry.
She's been mean to me the whole time.
Whatever. Whatever. I'm going for my week 6 appointment today. I probably won't record or anything in the room. My husband's not able to go with me, but a little update in the 6 weeks. My boobs are finally starting to feel better. It took forever. Like they were still like sore, still swollen. I'm still icing them. Icing helps tons. It's mostly my one side. My left side's a little sore, but overall they're finally improving. I was finally able to start light walking on week 5, I believe, last week. So that went really, really well. I did some like body weight leg stuff, like squatting, lunging, things like that. Today I'm going to ask about when I can add in upper body training because I missed that so much. But overall, I'm really happy with the results. So looking great. So I'll kind of update you after the appointment. So I realized I can't count while I'm waiting for the doctor. This is 4-week post-op, not 6-week. So I started walking on week 3. So yeah, I'm not sure about if I can start lifting or not. So we'll talk to the doctor and I'll let you know. So I finished the appointment with the doctor, and that was my 4-week opt appointment, and he said I'm fine to do like body weight exercises, like with a booty band. I have my own booty bands, by the way, and like I can do walking on the treadmill. That's absolutely fine, but I have to wait till exactly 6 weeks till I can do any lifting weights physically with my legs or my arms. So 2 more weeks to go.
Yeah, this is a very future update.
Yeah, so sorry, my life just gets a little crazy. Anyways, this is about 7 months. My boobs are fully healed, and maybe you can zoom in. Do you want to see it? What I'll have my husband do. Maybe we'll put a picture up, like to see like what I looked like before. But everything's going well. They're healing nicely. They were sore up to about, I want to say month 5 or 4 for me, but now they're fine. So, but yeah, I'm really happy with them, and Dr. Labrasca did a great job.
Look at you.
Yeah, getting ready for my photo shoot. For Erica Fit Love.
I got up for the letdown, watching you just let my love go hit the ground. My heart was the only sound in my bedroom. In my head you weren't gone. I found pieces that you left, parts of you I didn't even know I had. So I put them on the shelf in my bedroom. In my head you weren't wrong. I spent every night chasing after highs. Needed more, I needed more. Every set of eyes cut through.
Girls, you did good in your photo shoot.